Med Decode. Welcome to Med Decode. Okay, so when we talk about heart health, cardiac recovery, what's the first thing that comes to mind? It's always, diet, exercise, maybe some specific medications. But what if the single biggest factor, the one that really decides if you recover long term, isn't in a pill bottle or on a treadmill at all? What if the secret weapon is actually the person you share your life with? Today, we're doing a deep dive into the medical review that asks that exact question, what about love? We're unpacking this pretty surprising idea that a good relationship might be just as vital as, say, managing your cholesterol.
That's the mission, exactly. And it's all based on a really significant 2025 medical review. And this wasn't just a small study. It was a massive look at multiple randomized controlled trials.
VRCTs, right? The gold standard.
The gold standard, yeah. They were all looking at couples-based interventions for patients recovering from heart disease. We're talking about data from over 1,400 patient-partner couples.
1,400 couples. That's a huge sample size. So what was the big takeaway? The headline from all that data? Is the state of your marriage, is it actually medically relevant?
The takeaway is pretty striking. It should honestly change how we think about heart health. The review confirms that social relationships, and especially high-quality intimate ones, play a significant role in cardiovascular outcomes. And the key thing is, the size of that role is comparable to the big established medical risk factors.
Wait, so you're saying relationship quality is in the same league as things like high cholesterol or smoking? In terms of predicting survival.
That is exactly what the data is telling us.
Okay, we have to unpack that. We usually think of loneliness as just an emotion, right? You feel a bit down. Yeah. But if we're putting it in the same category as smoking, what's the actual, the scale of the risk here?
The scale is immense. To give you some context, there was a landmark meta-analysis back in 2010. It showed that participants who had stronger social relationships had a huge 50% greater likelihood of survival from all causes.
50%. That is an astounding number. You think about the gains we fight for with new drugs. A 10% reduction here, maybe 15% there, a 50% better chance of survival just from having good relationships. That completely changes the game.
It absolutely does. The protective effect is right up there with, say, perfectly managing your diabetes or blood pressure.
Mm-hmm.
Now, let's flip that coin. Let's look at the danger of isolation. Being socially isolated, being lonely. That's associated with a 29% increase in the risk of coronary artery disease.
So it's not just in your head. Loneliness is actively, physically stressing your heart.
Precisely. And the partner relationship seems to be a really key piece of that puzzle. The data shows that unmarried people, so that's never married, divorced, or widowed, they are over 40% more likely to die from a heart attack than married people.
Wow.
And look, this isn't a judgment on being single. It's a medical observation that the lack of that one core support system creates a measurable vulnerability. It even leads to more hospitalizations, more ER visits. It's a real systemic health threat.
Okay, so we've established it. A good relationship helps you live longer. That's clear. But the research said it's not just about having someone there. It's the quality of the relationship that matters. The RQ, as they call it. The warmth, the support. So how does that quality translate into actual physical protection?
A high-quality relationship acts like a multi-layered shield. And the research breaks it down into 3 core pathways: physiological, behavioral, and emotional.
Okay, let's start with the physiological. You hear the phrase broken heart. Is conflict literally breaking your heart?
Physiologically, yeah, you could say that. A negative relationship, one with a lot of hostility or distress, it triggers this constant low-grade stress response.
Fight or flight mode.
Exactly. Your body is always primed for it. So you see higher heart rate, higher blood pressure, and a constant surge in cortisol, which is the main stress hormone.
Right, cortisol. That's the one that keeps you alert, but just wears your body down over time.
It really does. And what's critical here is that sustained stress also raises these things called inflammatory markers, specifically cytokines like IL-6 and C-reactive protein.
Okay, what does that mean in simple terms?
Think of it like a little fire constantly smoldering inside your arteries. It causes low-grade damage day in and day out, and that directly contributes to heart disease getting worse.
So if you're constantly bickering about who takes out the trash, you're literally adding to the inflammation in your body.
Absolutely. But here's the amazing part, the other side of it. Simple physical intimacy, like hugging, has been shown in studies to directly lower your daily cortisol levels.
So affection is like a fire extinguisher for that stress.
It is, and for women, the data was particularly sharp. A single unit increase in negative relationship quality was linked to a nearly tenfold increase in uncontrolled high blood pressure.
10 times the risk. Wow. That definitely puts picking a fight into a new perspective. All right, let's move on to the second mechanism, behavioral synchronicity. This is how couples sort of copy each other's habits, right?
Yeah, and this one is a powerhouse because your partner is basically the gatekeeper to your daily environment and your routines. The numbers on this are just massive.
This is where it gets really interesting for me. If your partner gets physically active, you are 67% more likely to get active too. That's not a small nudge. That's an overwhelming statistical push. You're setting alarms together, making healthy meals together.
The effect is just as strong for quitting smoking. You've got a 48 to 50% better chance of quitting if your partner quits with you. But, and this is a big but, it only works if the support is the right kind.
What do you mean?
The studies found that overprotective partners, or, controlling partners, actually made things worse. They worsened the patient's self-care.
So support that feels like nagging or policing just backfires?
Totally counterproductive. You feel like a kid being told what to do, and you push back.
That makes perfect sense. Okay, finally, mechanism C, emotional regulation. How does emotional support help?
A high-quality relationship is a huge emotional buffer. When you have a partner who's responsive and warm, things that are stressful just don't seem as threatening. Your ability to cope goes way up, and that helps you regulate your own mood, which has a direct effect on your heart rate and blood pressure.
And why is that so critical?
It's vital because mood disorders are silent cardiac killers. We know that depression, for example, is linked to a terrifying 4.9-fold increased risk of a major cardiac event in the next year. A good relationship is like a firewall against that kind of mental health damage.
Okay, the science is clear. A good partnership is a cardiac superpower.
Real.
So what happened when doctors and nurses tried to actually use this in the real world? The review looked at 12 of these couples intervention trials. Did they work?
They did, but in a very specific way. See, these interventions were mostly led by nurses or exercise physiologists. They were very practical, very behavior-focused, teaching couples how to check vitals, track what they eat, schedule exercise, organize pills, that sort of thing.
So what were the big wins from those trials?
Health behaviors. That was the clear success story. 77% of the studies showed real improvement there.
And that led to
tangible results. Better adherence to exercise and cardiac rehab, more people successfully quitting smoking, better medication compliance. They even saw some risk factors improve, like cholesterol levels. And a nice bonus, it led to fewer unnecessary doctor's visits.
That all sounds fantastic. I mean, they solved the behavior problem. But what about the mental side, especially for the partner, the caregiver? That's a huge amount of stress.
And that's exactly where the results they get mixed. Mental health outcomes, like depression or anxiety, were inconsistent. Some studies saw improvements for the patient, some for the partner, but many found no difference at all.
So it wasn't a reliable fix for the emotional strain?
Not really. The one place it did seem to work well was in really acute situations. Like for partners of men who just got an ICD, that's the implantable defibrillator.
Right, the device that shocks the heart.
Exactly. Those partners, when they got specific support, they reported big drops in anxiety and caregiver burden. It just shows how intense that immediate stress is.
Okay, but this is where the story takes a really sharp turn, right? This is the most critical part of the review. If relationship quality is as important as cholesterol, and these were couples-based interventions, they must have made the couples happier with each other. Did they actually improve the relationship itself?
And that is the astonishing failure, the critical gap. Of the very few studies that even bothered to measure relationship quality, or RQ, 0 out of 3 detected any significant improvement in relationship satisfaction.
0.
0.
So the couples got physically healthier, but they didn't get any happier together.
Exactly. They got better at the tasks, but not better at being partners.
That's incredible. It's like these programs were really effective at turning the partner into a kind of health manager or a medical assistant, but they completely failed to strengthen the actual emotional core of the partnership.
That's the analysis. It was a complete focus mismatch. The interventions were all about technical behavioral stuff led by medical staff. They weren't designed to teach communication skills or conflict resolution or how to build intimacy. The things that actually make a relationship better.
So it kind of sets up that nagging spouse problem we talked about.
Yeah.
The partner is told, make sure he does his exercises, and the patient just hears, you're lazy.
Precisely. And for the 30% of cardiac patients who already have distress in their relationship, forcing these tasks on them can just backfire spectacularly. The review said those efforts get perceived as criticism, blame, or nagging, and it just makes the psychological distress worse for both of them.
You risk the marriage to save the heart.
And it doesn't work. The conclusion is really clear. Future programs have to integrate actual psychological therapy, real couples-focused theories. The relationship has to come first.
So what's the path forward? We know the relationship is the secret weapon, but we also know the current approach is missing the mark. How do you build this into standard cardiac rehab without, overwhelming the whole system?
The experts proposed a really smart, scalable solution. It's a stepped care model that you build right into the existing programs.
Okay, so it's not one size fits all.
Right. It allocates resources based on need. So step 1 is for everyone.
What is it?
Universal relationship education. Every single patient and partner gets some brief, simple education. Maybe it's a short video, a group session, just something that explains why their relationship quality is so important for their physical health. It just gets the conversation started.
I like that. It normalizes it.
Yeah.
So what's step 2 for couples who are maybe struggling a bit?
That's the relationship enhancement intervention. For couples with mild to moderate strain, you offer a structured program, maybe 8 or 10 sessions. The research mentioned one called Healing Hearts Together, which teaches communication, how to manage the illness as a team, that kind of thing. It's about actively improving the RQ.
And step 3 is for the toughest cases.
That's right. For couples with really severe or long-standing problems, you need a referral to specialized couples therapy. Cardiac rehab just isn't the place for that kind of deep work. They need to be referred out to specialists in the community.
But this all depends on screening, right? Doctors are already so busy. How do they add check relationship health to the list?
And the experts had a great answer for that. They recommend a brief, validated tool. There's one called the 4-Item Couple Satisfaction Index, the CSI-4.
Just 4 questions.
Just 4 questions. You can do it right alongside the standard screening for depression. It's fast, it's easy, and it tells you who needs to be pointed towards step 2 or 3. So to just wrap up the main conclusion for you, couples-based support, it works. It's great for short-term behavior change, getting people to move, to take their meds. But if we want to really optimize long-term recovery and survival, we have to focus on the emotional side, on the relationship itself. The quality of that connection is the foundation everything else is built on.
So you now have this crucial piece of the puzzle that often gets missed in health advice. When you think about your heart health, don't just think about your cholesterol or your workouts. You have to recognize that the health of your partnership is a real, measurable cardiac risk factor. The two are completely connected. And here's the most provocative thought to leave you with, and this comes straight from the research. It showed that patients who were in relationships that were already distressed, they didn't maintain the physical activity gains they made in rehab. As soon as the program was over, they slipped right back into their old habits.
But the satisfied couples, they were able to keep those positive changes going long term. Their relationship acted like an anchor for their new, healthy lifestyle.
So for you, the long-term success of your physical recovery, whether you're still exercising a year from now, it might depend entirely on whether you invest in the quality of your relationship today. Forget the expensive supplements. Maybe the best thing you could do for your heart is just to make that relationship stronger. Thank you for joining this deep dive.
And that's a wrap on this episode of MedDecode. I really appreciate you joining me today. If something we talked about sparked your interest, or if there's a medical term that's been bugging you, let me know in the comments. And if you enjoyed this, be a pal and share it with a friend. We'll catch you on the next one.